community activist, and she's got an exciting guest. But let me get her on the stage. Georgia, where you at, Georgia?
Hello, hello, hello. Is it a brand new year?
Hey, you already know
Is it
what
a
time
new
it is.
year? All right. I am so excited. We're going to knock open the doors in 2024. Okay.
All right.
We are so excited about this new year. And I'm going to kick it off, as always, by giving greetings. I am Georgia F. Allen. This is our show. It's a community show. GA for Just Is, because it's just is the right time to work on behalf of our community. So I am always excited to be able to talk with our community and share a little information. Thank you, thank you, thank you, Mr. Henderson Vaughn, aka the Dream Maker, aka Captain 85. We just call him C85, C85, C85.
I
And
thought
he
I was feeling naked.
has been so kind to open up the airwaves to us so that we can just have a conversation. You know, everybody's out here talking a whole bunch of mess, and we simply like to have a conversation for information, a conversation for correction when necessary, as well as a conversation for transformation, because we got to transform some stuff that's going on up here. Okay, because we have been out here for a minute fighting on behalf of our brothers and our sisters to hopefully make a good impact. One of my favorite people has always been the late Reverend Vernon Johns. And Reverend Vernon Johns had this saying. He said, man, if you see a good fight, get in it. And I'm one of those people that I love a good fight. So today we are so very excited to begin our new year. We're going to start it similar to the way we did last year. The first 9 months of the year, we're going to focus on a Kwanzaa principle. And then the last three months, we will maybe focus on a couple in a month. But the first 3 months, we're going to focus on the Kwanzaa principle. And so, of course, the first principle of Kwanzaa is umoja, unity, to strive for and maintain unity in the family, the community, the nation, and the race. And this is so critically important because right now there's a lot of chaos going on. People are at odds with one another for minor situations and everything is up in arms. And so we need to tap some of this down. And as a community, especially as a Black community, we need to make sure that we are talking to each other in a manner where we can come together and coalesce and work on behalf of those who are at a disadvantage. Some of us are doing well. Some of us are not. Some of us are trying to do a little better. But there's a lot of things that are taking place. And it's up to those of us who are out here, who are in the good fight. As my brother, my father would say, Reverend Vernon Johns, if you see a good fight, get in it. And so I've been getting in good fights for over 30 years, and I love it because outcomes get better when you get in good fights. So with that being said, welcome to GA for Justice. And yes, it's going to be an exciting year. I'm going to be like this pretty much all year long because I'm ready for fights. So with that being said, we have a very, very special guest. And, you know, sometimes you need some allies because a lot of times people claim to be allies, but they're not really allies. They're acquaintances, okay? But they're not really allies. But I can share with you today our very, very special guest. And I hope I don't get his name incorrectly because it's a very simple name, but you know, there's ways to accent people's names, but I will say Mr. Eddie Say. He is coming on. Hello, Eddie. Mr. Eddie Say, he is our health care committee chair, and he has been doing a phenomenal job with the NAACP. Our topic today is your health. How will you protect it? Because guess what? we can't protect your health if you're not willing to do some preventative measures, things. We can't protect your health if you're not willing to get education. We cannot protect your health if you're not going to do the little basic things that need to be done. So Mr. Eddie Say attended James Madison University in ODU, where he earned his teaching certificate and majored in interdisciplinary studies. He completed graduate work at the University of Virginia with a master's in public affairs. Eddie have held corporate positions in transportation with Revlon and in human resources with Blue Cross and Blue Shield. He's completed 8 years of work with the Obama organization in community organizing around healthcare, immigration reform, and climate change. Currently, he works as director of organizing for Freedom Virginia, a nonprofit focused on affordable prescription drugs, paid family medical leave, child care affordability, and raising of the minimum wage. He has also worked across the state of Virginia on issues in support of Black Lives Matter. And finally, Eddie has worked in all regions of the country on political races and issues. And again, he is the chair of the Virginia Beach NAACP Health Committee. And we are extremely proud and happy to have him as an ally to the local branch of the NAACP. And welcome, Eddie.
Thank you, Georgia. I feel honored to hear your words there. Certainly, my goal is to be an ally, and I think that what you said about allies is very important. So, on a second note, my name is pronounced C, but
See,
yeah, but
I knew
everyone
I was
does
going to.
that, so it's
All
not a
right, we
problem.
see ya. That's what I'm going to have to remember. Eddie C.
But as I said, it's a true honor to be a part of the NAACP. Uh, Going back to high school, I remember the NAACP, and always up into my college years, that organization was very important to the work that I did. And so I've been in the NAACP for a long time as an ally, and I think that we've done some good work together. Um, and it's one of those organizations that sometimes I think people take for granted, not just Black people, but all people,
Mm-hmm.
because we're out there fighting for the rights of all people. And I know that we are totally, people connect us with the Black community, but the things that we fight for are for many communities. And I'm honored to be a part of the NAACP.
Well, we're glad to have you on our team. You have been a person that came in and you hit the ground running. A lot of times people come into organizations and associations and everything and they come in because they want something, not because they want to give something or not because they want to do something. They love the glitz and the glitter, but they don't really care for the rolling up the sleeves and doing the hard work. And I can say from day one you have been uh, a stalwart in terms of working hard on behalf of our community. When we've had events and everything, and we needed someone to work the table to do membership drive, even though you weren't the membership chair, you were there more than some of the people who have been a part of the association, and so we really appreciate that. But today, it's your health. How will you protect it? And I came up with that topic because I never know what I'm going to come up with. But I came up with that topic because people forget how important it is to do some of the little things like go to the doctor in advance and not wait until something happens. So in order to protect your health, there are some things that you have to do in order to make sure you stay well. So with that being said, I'm gonna let you talk a little bit about the work that you do in with the other organization that you are part of, in addition to the work that you do with the NAACP. Freedom Virginia, you're looking at things such as paid medical leave. You're looking at things such as How do we get the prescription drug prices a little bit lower? And those type of things, or child care affordability. Those are the things that you are looking at to try to bring about a positive impact on communities, especially those who are disenfranchised. So sort of share with the people your vision as a health chair committee person.
You know that there's not a lot of collision between the jobs that I do. One is a volunteer for the health committee for the Virginia Beach NAACP, and as director of organizing for Freedom Virginia. In fact, those organizations complement each other. Now, one is a job and one is a volunteer job, but I look at those positions as it doesn't matter whether they're paid or not. And I think a lot of us do this, that there's still work to be done, and it doesn't change the importance of that work, whether it's volunteer or whether it's a paid position. It doesn't matter. The things that we do are important to the community, and very much a part of all the things that we do. So Freedom Virginia, I'll talk a little bit about Freedom Virginia, but it's an affordability organization. And we concentrate on issues like prescription drug affordability. And I'll tell you just a few things about that. 1 in 4 Virginians, now this is in total, when we look at statistics of color, it's even worse. But 1 in 4 Virginians have issues with affording their drugs. And we hear all these stories about people having to divide their pills and all of these things like this, are not even being able to afford the drug in any way. And they just have to go through life. And some of these drugs, in fact, a lot of them are life-saving drugs. So our system is not created to allow people to navigate that system really easily. And it is really hard for many people to get assistance when it comes to prescription drug affordability. The state of Virginia did some good work a few years ago. We opened up Medicaid and increased the coverage for many Virginians that didn't have it before. One of the most important things as a result of that, though, was a cap on insulin. And Virginia was one of the first states that did that. Now, there's so many other drugs out there that need that cap so people can afford them at all levels. You know, a lot of people, and this happens in the Black community a lot of people meet that are just at that threshold of getting any kind of assistance. And when they're at that threshold, the minute they move a dollar over, assistance is denied. So
that's scary. That's
yeah,
scary. Just that little bit can determine whether or not you can get that assistance or not. So that's a very important point to make, Eddie.
And so our position with that particular issue is that anyone should be able to afford drugs. And there needs to be a cap on drugs, especially in the United States, where our drugs are 4 times, 5 times, 6 times more expensive than any other country is paying. And that's unfair to our people. And it's also extremely unfair when we know the statistics about our communities of color and our communities that are poor and in poverty. We know that those are the communities that are not being able to access these drugs. It's not the wealthy communities. And so we've got to make changes with prescription drug affordability. The other thing I want to go over now, you know, we're also very focused on childcare affordability and minimum wage laws and public housing.
Mhm.
And those are issues that we face. Why are those healthcare issues? But they are, because all of those things, for example, childcare.
Mhm.
When you don't have when childcare is taking 1/4 to half of the money that you make, then you can't afford going to the doctor and all those things that are necessary to protect your family. So these issues, we've chosen these issues as ones to fight for because they really impact us every day. And we have got to get better at those things that impact our citizens every day.
That
Uh,
is critically important. That statement is so important. You got a big shout out from Bernita. Bernita says, "Hello, Eddie."
Hello.
Absolutely. And we thank you, Eddie, so much for your presence and the work that you do.
Thank you, Renita. These I'm talking to two people, though, two of my favorite people, Benita and Georgia here, and the relationship has been so positive from day one, and it's a joy to work with people that really are dedicated to making things better. A lot of us get out here and say these things, but we really do nothing to make,
Right.
as far as making that statement active.
Right.
Well, that's not true of you guys.
Well, thank
And
you. Thank you. Thank you. And that is true when it comes to you. You get out here again. I'm one of these people. I like to see people roll up their sleeves and go to work, you
mhm,
know, instead of walking around and profiling. And
mhm.
they showed up, but they didn't do anything, but I was there. I
Yeah,
was at the event, but I didn't sit down to the table. I didn't pass out any information. I didn't talk to anybody that was there. I walked around and I went home. And so the one thing that Benita and I both can say about you, and Juanita and others who know you very, very well, we can all say the same thing. The one thing about you, you don't just show up. You put in the time and you put in the effort and you put in the work, and we appreciate that. We are stronger and better because of you being there. One of the things that I wanted to kind of let you share with us, there's been a recent, um, uh, uh, they found something that could help with sickle cell. And I think you talked to me a little bit about that. I wanted you kind of share with the audience, what is this perhaps new treatment, or what is the gene that was found, or whatever, because I'm not a medical person. So that's why I rely on people like you who have worked in the area to kind of share with the listening audience. Because again, the whole reason why I have these conversations, and I do call them conversations, is I want to provide information to the listening audience that maybe mainstream media just, brushes over and don't even bother to, they feel like it's not that important, but we feel it's important. So if you want to share something about that sickle cell information, that would be great.
well, one of the issues that I started working on quickly when I joined the Virginia Beach NAACP, the first meeting that I went to, and all my life I've heard about sickle cell, by the way. Now, that doesn't mean I knew what sickle cell was all about, though.
Mhm.
I knew it was an issue in the black community, and therefore I was interested in that issue. However, I didn't know how significant it was in the Hampton Roads area. And this area right here in the state of Virginia is critical as far as the treatment of sickle cell goes, and the numbers of families and individuals that have sickle cell. And so I became really interested in that. And, people like Judy Anderson and Ayana Johnson really brought me to the pinnacle, I guess, if you want to call that, of trying to understand this issue a little bit better. So when as early as the summer, the only known cure was for blood and bone marrow transplants, and that was frowned upon by most physicians because it was extremely dangerous, and you had to find a donor, a family donor, that matched completely that bone marrow. I'm not a physician, so anyway, but it had to match completely. So now, over the summer, though, we heard about one is manufactured by CRISPR, and it's called Exocell. Now, it has been proven. Well, I'll give you some statistics, but there were at least 30 study participants in one of these studies. And that particular gene therapy that Georgia reviewed or told us about has cured those patients for at least a year. Now, that's all the data we have, though. We don't know what's going to happen in the upcoming years, but we are hoping that that is going to be a thing that is going to be a cure for sickle cell. Now, there's lots of there's other companies that are working on this, but they're all working on the same approach, and it appears to be working. We already know it's worked for a year, and we're following those same people and adding people to that study so that we can hopefully prove that that there are no side effects, because there haven't been so far, and that this is an effective therapy. Now, I don't know if you want me to get into this or not, but there's an issue.
We always like to hear both the pros and the cons.
Okay, there is an issue. And the issue is this therapy is going to cost millions of dollars, at least $2 million for individuals.
$2 million.
$2 million. Now,
let me ask you something, because when I hear figures like that, and I hear how in many instances when we come up with a new possible cure or, medical breakthroughs, etc., that we have all of these colleges and universities that are research institutions, that the federal government, which is our money, pays for these research institutions to do all of this type of work. And then after they find perhaps the cure, or after they find new ways of treatments, etc., somehow it moves from the institution to these private pharmaceutical places, and these private pharmaceutical places then decide that they're going to determine how much these things will cost.
Exactly.
How much of that?
Well, and again, Georgia, that's a systemic issue. And how do we change that system? I mean, there are many things out there we could talk about. Certainly, there's ACA, there's affordable health care, there's Medicare for all, there's all of these different things that would change that system. But we're unable, or not unable, we can do it, but our politicians are against it. So now to proceed further with this, those are, one of two ways to get around this issue of cost. We set a price cap on the therapy or on the drugs or anything that's involved in providing this therapy, or we find a way for people to be eligible for cost reduction. And those are issues that are not easy to solve, but it's really a systemic issue. And certainly within the Black community, especially, we have got to find this works. Apparently it works. And we're going to have the statistics are proving that it works and appear to be going forward with a positive message about that. So we've got to find a solution to that, and we've got to push for those solutions. Those things don't just happen. We know that. We've seen it in everything that we've tried to do to better our communities and to, as my hero, Mr. Lewis, says, we need to make good trouble. We need to be
Absolutely.
involved in good trouble. And,
Absolutely.
uh, and until we get out there and do these things, the fight is not easy. How long have we been fighting for issues like this? For systemic issues to be improved. We could do a whole show about this.
A
But
very long time we've been fighting these systemic
yeah,
issues.
and that fight gets really difficult sometimes, even for me as an ally, not someone that's in the community. But I can tell you this: those of us that are working in these communities feel these issues. We are a part of these communities that we are trying to help. And the NAACP, Free Virginia, and all of those organizations are out there trying their best to understand these issues. Now, this is an issue with the cost of a drug that is going to benefit this community very much.
Mhm.
And how do we make it accessible and affordable?
Affordable. Exactly. The
So,
two A's, accessibility and affordability. Those are two powerful A's that we're going to have to do something about. Um, to those of you who are listening today, I have with me Mr. Eddie C. And Mr. Eddie C. is the health care committee chairperson for the Virginia Beach NAACP. And again, he has been working very, very diligently to help to educate the community uh, with regards to preventive care, with regards to making sure that you get your doctor visits in. I think the last couple of months of the year focus a lot on things like colon cancer, prostate cancer, and some of these things that a lot of times people, they're nervous about going. It's better to know than it is to not know. At least if you know, you can identify what your options might be. So we thank you so much for being willing to take on this task, because a lot of people, they don't want to talk about health care. It's like, shh. And
yeah, and
so,
when we talk about, getting out there and fighting for these things to happen, um, I will. I will tell you something that's coming up on the 24th and 25th of January, and that's our Advocacy Day in Richmond, where really the 25th is the important day, but we're having actually 2 days of it to actually go over this bill that we have in the General Assembly to get people to support it. Now, last year, this bill, Prescription Drug Affordability Board, was approved in the in the Senate. But in the House, obviously, under Republican control, and I don't mean that politically, but it's true. Under Republican control, we didn't win in the House. Now, this year, obviously, we had a better opportunity. We have a better opportunity, but we need people to come out and support that Advocacy Day. Those are very important legislatively. Those days are. Because we get to talk to our representatives, we get to talk to people that are kind of on the fence, and we do change minds. We've got a wonderful storybook out there. Some of them include members of our minority communities here in Hampton Roads with their own personal stories about prescription drug affordability. But we need people, we need faces. So one way that the listeners can get involved is to certainly be a part of that Advocacy Day. Shout out to Bernita, who signed up for that. But certainly, we need minority voices. Now, when I say we need minority voices, I'm not just saying that because I don't know. I don't want to say this in a way that's negative, but many of us, we want faces of minority voters because it adds a different picture to the cause. But my position there is yes, but we have to be careful how we manipulate those voices and how we use those voices. And so, one of the things I think is really important is to make sure that we're using those stories and those faces and those words in a way that really benefit the community as a whole. And I think that's very important when we organize in minority communities.
Well, I really appreciate you saying that, because as someone who I believe has been Black all my life, I'm
Mhm.
very familiar with exploitation when people
Right,
say, well, I'm here to help you.
right.
Really?
Yes.
Oh,
And
and many of those, huh?
many times we don't even really understand the issue in the community.
Correct.
We understand the issue as a whole,
Correct.
but how is it really impacting that community that you think you know?
Directly.
uh, that knowledge sometimes has to be gained.
And it gets lost. And
Yes.
again, a lot of times when people say they are here to help you, they are familiar with funding that has been made available, and so they put the person out front, and this is who we're going to help, but the majority of the money goes toward their own operation.
Mhm.
So the person that runs the operation, the various employees that they have, and by the time they finish with all of that, the money that's left over to directly impact the community is minimal.
Right.
So what you were sharing just now is very, very critical. And to those of you who are out there who are listening today, um, when I heard about the um, the gene therapy and the um, information regarding sickle cell anemia, I just want to remind you, if you have children, grandchildren, students, talk to them about maybe going into the medical field, but not just the medical field to be a typical doctor, but go in the medical field for research. Who knows what new medicine you may come up with? Who knows what you may identify and be able to change outcomes health wise for many, many people. The other thing is, when you're going into these various fields of study, look at how perhaps you might be able to go into those colleges and universities of research, but then you ultimately may be able to form your own manufacturing plant. And now you know that it doesn't take $500 million for this, that, or the third. And began to look at it from a different standpoint. If these pharmaceutical industries can operate and the federal government can fund them, then why can't they fund us? So, to those of you who are out there who are listening, who will listen now or maybe listen later, start talking with their children and asking them about this and saying, hey, how would you like to be the person that discovered a cure for diabetes? One that people would not have to take medicine every single day, because I'm a diabetic. I'm a more or less pre-diabetic. Type 2, I'm not a type 1. So I'm able to manage my diabetes. But it'd be wonderful if you could just find something and it was done. Because I remember growing up and we had medicine, but medicine didn't last for the rest of our lives. You took the medicine, you the medicine worked, you got healed, and you may never have to take that medicine ever again in your life. That's not the case anymore. They have these permanent medicines for us, and it's time for that stuff to stop. Well, Eddie, I usually take a short break where I talk to people and do some announcements. So we're going to take a little bit, and then we're going to come back to you.
Okay.
So there are a lot of things going on, and I'm just so excited. First thing that's happening is this Tuesday, January the 16th, the day after Dr. Martin Luther King Jr.'s birthday. We will be having a legislative day for members of the NAACP. That's going to be our day when we go there and we talk to the elected officials about everything from healthcare to climate change, to criminal justice, to education. So we're going to be in town on Tuesday. So anybody is interested in going to Legislative Day, please click on NAACP Virginia State Conference, and take a look at the website, and it'll tell you what is taking place. Another event that is coming up on this Saturday, the Virginia Beach Interdenominational Ministers Conference will hold its annual Dr. Martin Luther King Jr. luncheon. Now, this luncheon is going to take place at the um, New Hope Baptist Church in Virginia Beach, and it's located at 395 Old Great Neck Road, and it starts at 12 noon. Go online and look up Virginia Beach Interdenominations Ministers Conference for further information. The guest speaker is our own state senator, Aaron Rouse, who happens to also be my state senator as well. He's a state senator that represents Virginia Beach, but he is my state senator as well. So he is the keynote speaker, and we do encourage you to participate all over the city. You're going to hear of various events for Dr. King. And I always like to say Dr. King because I get prickly when they call him Martin. Did you know him? Was he your cousin? Was he your best friend? So why do you think it's appropriate for you to call him Martin? So I always like to say Dr. King, and I'll probably say that until the day that I leave this earth. And then the last event is Virginia Beach. We have what we call an annual Emancipation Proclamation Jubilee Day commemoration. And what we do is we have an event, and we can form it however we want, but we have an event where we remind people of what we've gone through and where we are today. And so this event is going to focus on our youth this year. And our keynote speakers are Reverend Dr. Veronica Coleman of New Jerusalem Ministries and Reverend Vanessa Copeland of Mount Zion AME Church. And again, it is going to take place on Sunday, January 28th, 2024 at 2 p.m. We're having an afternoon event that allows all ages and of people to be able to come while it's daylight and get home before dark. That the host church is New Light Full Gospel Baptist Church, located at 5549 Indian River Road in the city of Virginia Beach. And the zip is 23464. So they're over in the Centerville area. And the host pastor is Reverend Eugene Cowan. So again, we want to invite you to come out on January the 28th. It's a Sunday. It's a Sunday afternoon at 2 p.m. for the Emancipation Proclamation Jubilee commemoration. And we call it a commemoration because we think it's a little bit much to say celebration when slave enslavement did not end completely. Okay, so we're going to commemorate the fact that it led to the ending, but it wasn't an actual ending. And again, our keynote address speakers, I'm looking so forward to Reverend Dr. Veronica Coleman and Reverend Vanessa Copeland. So if you're not doing anything, it is a church service. So come on down and visit with Virginia Beach. If you don't know us, guess what? Get to know us. It's an excellent time to get to know the Virginia Beach NAACP. And we are very, very excited about this year's event. And so you got 3 events coming up. Saturday, the 13th, will be the Ministers Conference. Will have their annual luncheon for Dr. Martin Luther King Jr., and that is going to be held at New Hope Convocation Center. So that's New Hope Baptist Church, and it's their Convocation Center, and that will be at 12 noon. Aaron Rouse will be the guest speaker, who is our state senator. And then Virginia State Conference will have its legislative day on Tuesday, January the 16th. It's going to be from 8 a.m. in the morning to 4 p.m. So we want to encourage you to participate in some of these activities. And if possible, bring young people out to participate in these activities so we can start now educating our young people on some of these things. To our churches who are listening, pastors, ministers who are listening, perhaps you can get your church van, once a year, taking our young people up to the General Assembly and meeting their state legislators can be instrumental in changing mindsets, also changing careers. It will help our young people perhaps decide on different careers, because the committees that they will go to, those committees will be environmental committees. They will be prison committees that talk about criminal justice. There will be transportation committees meetings that they can attend. So there are a number of different committees meetings that our young people will be able to attend to meet persons who are elected to office. And in some instances, they may even have an opportunity to go to the microphone and make a statement. So take advantage of this. And with that being said, because I can go on a tangent, because I get excited about this, because I get excited about my young people. And again, this month and all month long is going to be your Mosier, to strive for and maintain unity in the family, the community, the nation, and the race. And that includes being actively involved and engaged in the political process, from the local level to the state level to the national level. And how do you know about how to do these things? You go to some of these sessions and meetings so that you can meet people and begin to get trained and learn how to do some of this, and learn how to change the minds. Because when we talk to legislators, we're interested in changing their mind on either how they're going to vote or support them on how they're voting in our interests. So with that said, I'm going to go back to Eddie for a minute, because there's one thing that one of the things that has been very front and center for the Biden administration, and especially for Vice President Kamala Harris, has been women's health and the maternity health crisis. And I wanted to know, did you want to talk about that a little bit? That's one question. And the second is, do you plan to have any upcoming health fair events? And if so, how can the public and how can Virginia Beach and others participate in perhaps some of the ideas that you have with regards to better educating the community, or allowing them an opportunity to get involved, join your committee?
Yes, definitely. I want to make, before we get to that, George, I want to make one comment about something
Okay.
you said earlier before we took a break. And that's about our students getting involved in the healthcare field. One of the things that we found and we know to be true is that, of course, we know our bodies better than anyone. And one of the things that we've faced in the medical care field, and Bernita may know more about this than I do, but I do know this. There have been times when we've treated our Black patients differently, or based on the knowledge of what goes on in the white communities.
Mm-hmm.
And it's not this is not a racial issue in itself. It's not that we treat people differently based on color, but in reality it is. So one of the reasons we need involvement from the minority communities in healthcare is to make sure that all those protocols and things that need to be changed as far as treatment in those communities, there's knowledge of that. And many Black patients are more comfortable seeing a Black physician, and that's fine. But we still don't have the staff to make those things happen. It's not desegregation. It's not, that's not what it is. It's making sure that we get the best care possible. And Georgia, that is another reason for making sure that we all people are represented in that healthcare field, and we need Black representation.
Absolutely. Absolutely. And with that being said, we also need to remind people that in the city of Virginia Beach, we have a health science academy at Bayside High School. So any students that are out there, if their parents listening, if your child is interested in health, talk to them about perhaps trying to see if they can get into the Health Science Academy. I think it's a nursing program and other things. Righty? So
All right.
go ahead.
Yeah, let's
Talk
talk
to us.
about Black women's health care. And specifically, I want to focus on mother mortality rates and infant mortality rates, because that's a huge issue within the Black community. African American, when we talk about infant mortality rates, it's twice the rate for white infants. So, and when we think about that, why do we think that's happening? Yes, Georgia.
Well, one of the things that we hear all the time is that our bodies can take more pain. So the doctors don't feel the need when we say, hey, something is not right, to immediately address that. So that has been one of the many things that has taken place.
Yeah, and all those myths out there, such as the one you said, Georgia, still exist whether we want to admit that or not.
Correct.
And we have to admit these issues. But that's definitely one of the reasons why that infant mortality rate could be higher. We also know, well, let's talk about the maternal mortality rate a little bit too. Black women are 3 times more likely to die than white women. So again, we face a statistic there that's really unbelievable.
Correct.
And now we know these things. And how are we reacting to these issues? Certainly one of the issues is what Georgia brought up about having more Black people involved in healthcare. That's certainly an issue. But let's think about some of the reasons that this is happening. And it's not just when we talk about moms, it's in the minority community, and especially in the Black community, more so than others. We have a high rate of high blood pressure. We have a huge high rate of diabetes. Now, these are all risk factors in pregnancies. And so we've got to get these things under control.
Correct.
Within our communities. And one of the things about that I was really so interested in as a result of the convention in Boston this year was what they're doing in Boston to open up health centers within the communities to meet these needs. Now, we do have some of that here in Virginia and in Virginia Beach, but it needs to be more community oriented. And these needs, the people need to respect and trust these people that are manning these healthcare units. And so certainly that's the issue. But when we have all these risk factors and they're predominantly higher in the Black community, then we're going to face issues like higher mortality rates for both infants and mothers. And so again, now these are issues that impact the community as a whole. And they trickle down to more specific issues like maternal health care and infant mortality rates. So diabetes is a huge one. Obesity is one. Now, why is obesity an issue? Well, obviously it's a health issue. But what is causing obesity? And it again it impacts how mothers respond to pregnancies and things like that. A lot of it's because in our communities we have food deserts.
Correct.
And we have all these inaccuracies going on within our systems to allow people access to food when they need it.
Mhm.
And so we have income disparities and all these kinds of things that are causing so many of these healthcare issues. And we've got to solve these issues.
Absolutely.
And, so I'm trying to read Bernita's statement.
Yeah, she said, I'm amazed by medical professionals who trained when she did, and still they believe white women are more fragile than
Hmm.
black women.
Hmm.
This is untrue. So
Yeah.
thank you, Bernita, because see, this is the type of information people need. I know she has a background in the medical field as well.
Yes.
I know we're going to be coming close to a close of the show. So I wanted to know if by chance you knew of any upcoming, perhaps like any type of health fair.
Hmm.
And sometimes we don't necessarily have to create our own. Maybe there's one that's coming up that you might want to partner with. So if you can kind of share that with the listening audience, and then after you share that, if you want to do a final closing remarks, because we try to stay on time, believe it or not.
Right. There are a couple things coming up that I want to plan. Now, I want to continue this discussion, certainly,
Okay.
because there's so many parts of this discussion that the community needs to know and be aware of. So one of my first things is to plan a roundtable discussion in Virginia Beach and discussing these issues and making people aware of these issues. And as a result of that, offering some calls to action for us to take that are going to get these ideas out to the public
Mhm,
and also to our legislators.
mhm.
So that's it's probably not going to take place until March um, because of all that's going on in the General Assembly. But that's one of the things that I want to do to
Mhm.
make sure that people are aware of this issue. I mean, there's so many issues that we have resources for, and people need to know what these resources are, but we're not good at publicizing those resources.
Mhm.
So
Well, I'm
around,
gonna have to bring you back.
well,
I'm gonna have
well,
to bring you back with a list of resources. Said, look,
yeah.
healthcare. What are we gonna do about it? How are we gonna protect our health
Mhm.
and all? And you can come on and share with the listening audience that look, there are some
Mhm.
options out here.
Mhm. Well, I certainly I'd be happy to do that, but I do want to plan that roundtable, and I
Okay.
want to get that out to as many people as possible. Not only somehow we've got to reach people in our communities that are not like you and me, Georgia and Bernita. We've got to reach those people. I'm not saying that we don't have any of these issues. Certainly, I'm sure we do.
Yes.
And when I say I include myself in these issues because they are my issues, whether people want to think that or not, these are my issues.
Mhm.
And so we've got to get it down to a level where people are actually experiencing these things. And we've got to get their voices in the room. So that's part of my goal as far as this is concerned. Also, I do want to plan uh, a fair
Mhm. A
and
health fair.
a healthcare fair. Now
Okay.
that's going to include certainly services that we normally see at a healthcare fair, like
Mhm.
testing and things like that, but also some information on resources available when people are realizes they're having these issues and they
Mhm.
need help. Like Freedom Virginia would set up a table and talk about prescription drug affordability. So it wouldn't be a typical health fair, but it
Mhm.
would be one where people can access those tests and things like that, see how they're doing,
Okay.
maybe have a nurse or a physician there to talk about some of these issues, and
Mhm.
then look at all these different healthcare organizations within the community that might be able to help.
Mhm.
So that's the kind of approach I want to take, and certainly we want to move forward with those ideas. And those are
Terrific.
the two things.
Terrific. Well, we thank you so much for joining us today, Eddie C. And
Yeah.
that's important that people pronounce your name correctly because I tell you, I run into people all the time that want to call me every type of Georgia there is other than just plain old Georgia. And so, Eddie, do you have any final comments today? And then after that, I'll switch back to me and we'll close out the show for today.
The only comment I want to make is we talked about this earlier a little bit. Be an advocate.
Be an advocate.
Be someone that's willing to work, because again, I know we get tired of this.
Mm-hmm.
Your voice is the most, and your vote is probably the most important thing that you have as far as making change.
Mm-hmm.
And so we need your voices. We need your votes. The things always happen in the way that we want them to when we vote, as far as what that candidate promised. Not all the time, but it does give us the opportunity to hold their feet to the fire and make sure that they're doing the things that we said they were going to do. Otherwise, we don't have much recourse. So that's the one thing that I think is really important. You might not think it has a lot to do with healthcare, but it does, because we need activism. We need organization. We need all those things that John Lewis says is good trouble.
Absolutely.
And so I just encourage being involved, and certainly reach out to me. Let Georgia know, or any others that you want to get in touch with Eddie, and I'll be glad to assist in any way. So, thanks, Pernita. Really appreciate that. Definitely.
All right.
Definitely, and you will be one on that list for sure.
Well, Eddie, we want to thank you so much. This has been a very enlightening conversation. And this is what I try to do. 2 weeks ago, when I was on the air, I had a quote by Quincy Jones. I couldn't find it anywhere. So for those of you who listened to me 2 weeks ago, I do want to read this quote today. And it's actually not Quincy that made it. It was his dad. It was his dad that made this quote. And I think it's so appropriate, because we've been talking about how important it is for people to come into organizations, or for people to go to work and not just come for show and flash and everything. And the quote from Mr. Quincy Jones Sr. is, "Once a serious task is just begun, never leave it until it's done. Be the labor, great or small, do it well, or don't do it at all." So with that, I think that is so appropriate for this show today, because we talked about how important it is to go to your General Assembly, how important it is to speak to your legislator, how important it is to get involved, to get engaged, to execute. And all of those things are critical if we want to do what I've been saying since I've been on the air, and that is a conversation for transformation. We want to transform what has been taking place over all these many years and bring about a more positive outcome. And we can do that if we follow this little quote that Mr. Quincy Jones Sr. said. If you're going to start something, finish it. If you're going to get in a fight, if you see a fight, get in it. Okay. If it's a good fight, go ahead and get in it. And as Eddie said, his favorite former Congressman John Lewis, get in some good trouble. We need you guys. You can't sit on the bench. And with that being said, I want to thank you all so much for listening. Henderson, we're ready for you to help us close out, because I don't know how to do the closeout thing. Thank you so much for allowing us this opportunity to share with the listening audience today.
Yeah. I want to thank you and your guests for coming on GA for Justice each and every Thursday from 12 until 1 on behalf of the community and WVDM. Thank you so much. And we'll be looking forward to next Thursday from 12 until 1. Until then, bye-bye.
Bye-bye.
Bye.